is that time. It is that time. Remar Nurse University starts tonight. Remar Nurse University starts tonight. All the kids are out of school for the summer, but guess what? If you're preparing for NCLEX, RNU, your first class starts tonight. We're going to talk about infection, prevention, and control right here on Today. This is Monday Motivation. If this is your first time joining, hi everyone. My name is Professor Regina, MSN RN. I am so happy to be your mentor, your teacher, your instructor on your journey to getting your nursing license formally. So we do a NCLEX review session for our community every Monday right here at noon Eastern time, and then on Wednesdays at 9 p.m. Eastern time. But you will be happy to know that during the month of June, we have a mandatory study session every Monday night. We call it Remar Nurse University, and it is your opportunity to really prioritize your goals of passing NCLEX during the month of June. And guess what? It is free for you to attend. So there is no excuses why this cannot be your time. This cannot be your time. Hi, everyone. I have a global community here. I see you nurses from Kenya in the house. They are up, ready to go. I have nurses from the US as well. From all over. And like I said, again, we're going to be focusing in on pharmacology for Remar Nurse University this year. So on tonight, we'll be looking at cardiac medications. If you have the workbook, you need to bring it to class tonight. Workbook looks like this. I sent it out to everyone. Okay, I sent it out to everyone. So make sure that you have it on tonight. This is the RNU workbook. June 10th, we will be doing renal medications. And then we're going to do simulations the 17th and the 24th. So every night of the week, we will be filling this out. And again, if you don't have the workbook and you just want to come to class, that's fine too. But the workbook is going to give you the medications that we will be looking at, the patient scenarios. So if you can get it, and have it for tonight. I see a lot of people say I have it already. So that is awesome. That is awesome. That's what we want. What else? If you haven't signed up for it, not too late. It's super easy to do. Go to remarnurse.com/RNU /RNU. And what it is going to be the opportunity for me to teach you about the many different aspects of NCLEX and how you should think about them. So we're all going to be doing next gen NCLEX review. We're going to be talking about pharm. We're going to be talking about priority, which is one of our favorite things to discuss here. CAT exams as well. I have those in my V2. We'll talk about how you're going to address those, delegation, and I'm going to have some mock exams. So all of those good components of the NCLEX are coming from my program. I hope that you have it and that you have already started your studying with me. If you have not started my NCLEX program, I have good news because we're going to be doing the sale of the year, the lowest price of the year. I'm going to be dropping for RNU. And it's really not about the price because honestly, the cost of having your nursing license, you can't really put a price on it. But I will tell you that the investment that you can make towards yourself, this is the best time to do it. So if you want to begin training, you're taking your NCLEX in June or July, then this is the time to hop into my NCLEX review. I hope I'll be able to give you all of the information and not just some of it during RNU, but look at the prices, check them out for 1 month, 3 months, or 6 months in my NCLEX review. The prices are going to be amazing. They're going to be amazing. So tap in if your results are what you are after during this month. Okay. All right. So we have everything to get started right now to talk about infection prevention and control. Now, what I love about a topic like this is that you can memorize these things, okay? You can memorize. Remember when NCLEX was just like memorizing facts? It's not like that anymore, but safety and infection control is like that. You answer the questions by what you have studied and memorized. And we're talking about a safe and effective care environment, which is one of the largest client need areas on the NCLEX RN and PN. So under safe and effective care management environment, you have management of care, which makes 15 to 21% of your NCLEX is going to be management of care. And that is your leadership. That's your prioritization, right? The next category underneath this particular area is safety and infection control. Safety and infection control. And that's 10 to 16% of the exam. Now, 10 to 16% may not seem like a lot, but it's a lot. It is a lot of your exam. So I have taken the time to present something to you today, but I go over, this is one of those things that I didn't put in quick facts. It's actually a lecture in the V2. So somebody said what page it is. Let me find a page for you. We went over it before, but on page 100, the lights on page 100 is the rest of the notes. It's right after EKG. So you can add these notes to your V2 workbook if you have it, All right. So let's get into it. We're going to talk about the importance of understanding this information because you do a lot of teaching when it comes to infection control. That is the main thing that nurses do. We teach our patients infection control. We understand it for ourselves so that we are not leaving home with the disease processes that the patients have or giving them to our family and our kids and our loved ones. Right. And we're also teaching our supportive staff. So we also have to remind our nurses' aides, sometimes the phlebotomists, sometimes housekeeping, how to keep themselves protected from the patient, So for my formal students, my visual learners, infection prevention and control is a practical evidence-based approach preventing clients and healthcare workers from being harmed by avoidable infections. Infection prevention and control, it affects all aspects of healthcare. But when we talk about this for NCLEX, you need to know specifically hand hygiene. Okay. And that's washing your hands with soap and alcohol-based sanitizers. You need to know about surgical site infections, how to prevent them, what they look like, injection safety. Huge, because we are breaking a natural barrier when we give a patient an injection. Antimicrobial resistance, how healthcare facilities operate, and also how they operate during and outside of emergencies, because that is that disaster management that I talk about. That is also part of reducing infectious diseases amongst the population. So infection and safety is a big portion of your NCLEX exam. Check this out. These are just statistics. 1 in 10 clients in a healthcare setting gets an infection while receiving care. Can you believe that? 1 in 10 people will leave the hospital with an infection that they did not come into the hospital with. 50 to 70% of injections given in developing countries are unsafe. That just blows my mind. So a developing country, we're talking about a country like, you guys give me some examples, like Brazil, right? Brazil, some country where there's poverty as a national experience, right? I'm sure there's others, but almost all of their injections are unsafe. And if you're like me, where you're like a traveler and you're also a nurse, the anxiety that we can have when we go abroad, right? Yeah, when we go abroad. But it's so important for us to bring our knowledge and our experience to these areas so that we can keep everybody safe. Yes, if say Haiti, Liberia, India, Venezuela. Yes, these countries. And so the medical care there can use definitely a boost, right? Up to 32% of surgical clients get a post-operative infection. So you can see why for NCLEX, this is a huge topic. Understanding how infections are spread. This is also your responsibility to know before you sit down and take the NCLEX. We know that an infection occurs when germs enter the body and increase in number, and then they cause a reaction. The three things that you need to have in order for an infection to occur are going to be a source. So a place where infectious agents live. All right. Are they in a surface? Are they in the air? Are they on, the bed linens? These are things that you need to understand. A susceptible person who is going to come in contact with these diseases, these germs, these bacteria, and not be able to fight them off with their natural defenses. And then also, how is this germ or bacteria transmitted? How is it getting from one place to another to that susceptible person? All right. Somebody says, please, everybody pay attention to this. It is so important. It is so important. We are also going to review today the modes of precautions. So we have our standard precaution, we have our contact precaution, we have droplet, and we have airborne. Those are the four that you need to know. Now, we are going to talk about here, what those precautions mean. Another thing that you have to memorize for NCLEX, and this is what I go over in here, you have to know the different diseases that fall under these precautions. So I want you to be mindful of that part. There's two parts. You got to know the precaution. You got to know the diseases that fall under the precaution. So standard precaution, these are things that we do for everybody. I love standard precautions, the thought of them, because they apply to all settings. They apply to all populations. They apply to all areas of nursing. So standard precautions, they help to protect both the healthcare worker and the patient by reducing the risk of transmission. And think about it like this. When we think of infection control, sometimes we are thinking about the mentality of keeping the patient safe. But actually, you need to take on the mentality of keeping yourself safe. These precautions were put in place, like it says, for healthcare workers, for you to be safe when you go into an environment like a hospital where there are so many different diseases. So nurses who are choosing to work in hospitals or community clinics understand that you are putting yourself at risk every time you show up for a shift. And so if you are being lax in these precautions, then you may end up getting something you don't really want to get. Okay. So this is what we're doing. We are trying to prevent the transmission of recognized and unrecognized microbial sources. These are the minimum. When we talk about standard precautions, we're talking about the minimum that is required by all healthcare workers during the care of all patients and in all settings. So it's not asking you to do too much. It's just like NCLEX. It's the minimum knowledge. Standard precautions, these are things that we do no matter what. We are doing a risk assessment, and that is the environment of the patient, what the patient has. We are doing hand hygiene. We are washing our hands. How long do we wash our hands for? We went over this. I think we went over this for the International Nurses Day. We did infection control. So if you haven't seen that, check that out, because that also goes over a different aspect of infection control. Hand hygiene, 15 to 20 seconds. Yes. Respiratory hygiene and cough etiquette. We are always educating everybody about where to cough. We are not coughing in our hands. We see the signs all over the place. Patient placement. Patient placement means you understand which patients go with which patients. So who do we cohort? Who do we put in a room? Somebody that has a droplet precaution disease, they can be in a room with somebody else that has droplet. Somebody that has contact, they can be in a room with somebody else who has a contact isolation disease. Somebody with airborne, can they be in a room with anybody else? No, they cannot. Personal protective equipment, aseptic technique, waste management, how to properly dispose of used items, environmental cleaning, safe injections and sharps injury prevention, and decontamination of reusable patient equipment. And understand that nurses are expected to perform all of these tasks. You know how you if you get a job description and guess what? You have that you're going to be working on a med surg unit. You might be taking care of 3-4 patients and passing medications, and you're expecting that. But when you get there, you're actually doing all these things all the time, right? The environmental cleaning, you're doing that. You're wiping down counters and beds and all the things. Welcome to nursing. You guys that's in it already, you know this is what we do, the extras, okay? So that's standard precaution. The next transmission-based precaution is contact. Contact. The understanding of contact diseases is that the infectious agent has to be in physical contact with a susceptible host or an object that it can live on. A lot of gastrointestinal diseases are contact precaution. Why? Because they live on surfaces. They live on surfaces. And if those surfaces are not cleaned, somebody can come and touch a sink or touch a toilet or touch a bedpan, and they can go on to the next host. All right, so people are correcting me. They're like, no, med surg is more than 4 to 6 patients. More med surg is 7 or 8 patients. It's true. Forgive me. I'm not a med surg nurse. I couldn't do it. Tele, cardiac, yes. I have here the two, when we talk about contact precautions, these are two terms you've probably never seen before. You don't necessarily need to have them memorized, but I do want you to understand how a contact disease can be transmitted. So the first one says a direct contact transmission. And so this involves having a direct body surface to body surface contact. So when you think about some sexually transmitted diseases, right, that are contact precaution, you need to have direct contact with that person's physical body in order to get these disease processes. And so this comes into play when you are looking at a website like CDC, Center for Disease Control, and they list a disease process that has multiple transmission-based precautions. So maybe they say this is contact and droplet, right? Contact and droplet. You need to understand how it is contact communicated and how it is droplet communicated. Indirect contact transmission involves a susceptible host with a contaminated intermediate object and something that can transfer the microorganism. So that kind of makes sense based on the definition. You need direct contact or you can have indirect contact. Droplet transmission. Droplet transmission is just what it sounds like. It is the infectious agent that is caused by the dissemination of droplets. And those droplets are actually into the air, and they hang out in the air for a short period of time. Does anybody remember how or what is the distance of droplet precautions, droplet diseases? So if we are within how many feet of an infected patient can we get a disease such as meningitis, right? Meningitis is droplet precaution. All right, so droplets are primarily generated from an infected person during coughing, sneezing, or even talking. Even just talking, if you have a patient, an elderly patient, they might not have their dentures in. And so is nothing there to prevent that saliva, those droplet nuclei from getting into the air. So we're going to say 3 feet for NCLEX. 3 feet for NCLEX. This is good stuff. And then, so we talked about standard, universal, you should know it. We talked about contact, what it means, droplet precautions, and now we are going to airborne. This is the most serious of the isolation precautions. These are the patients that don't get roommates. These are the patients that you have to put on everything in terms of protective personal equipment. You got to put on the special respirator mask. You got to put on the gown. You got to put on the gloves. Airborne transmission. This is a spread of an infectious agent that is caused by the dissemination of droplet nuclei that are infectious and remain suspended in the air over long distances of time. Okay, this is very important because once a person with an airborne disease is allowed into a general population, like a hospital waiting area, okay, a pediatric waiting room, a school, it is highly likely that multiple patients will result from being in contact with that one person. And so airborne transmission can also be further categorized into obligate or preferential airborne transmission. Again, these are just words that I want to expose you to, because although you might not see them on the NCLEX, if you are working out in the community, some of you might actually be infectious nurses. This may be your thing. You might come across these words, okay? Obligate airborne transmission means the pathogens are transmitted only by deposition of the droplet nuclei under natural conditions, okay? Preferential airborne transmission refers to pathogens that can initiate infection by multiple routes, but are predominantly transmitted by droplet nuclei, okay? All right. So the droplet diseases, I see them in the comments. You said it is tuberculosis, it is varicella, and it is what else? Tuberculosis, varicella, and MTV is on the air. Measles. Yes. All right. If you're just joining me, what's happening is we are in the midst of preparing for NCLEX. Our subject for today was safety and infection control, infection prevention. So that is what we are going over right now. Now I want to talk about just the 5 points of hand hygiene. Very important when you should be washing your hands for NCLEX. Okay, for NCLEX. So before touching a patient, number one, when you come into a patient's room, the hands should be washed. When I go in to see the doctor and when they are not rubbing their hands together when they are walking in the room, I will ask them, hey, can you hit that hand sanitizer for me? Or, have you washed your hands? Or I'm looking. I say honestly, most of the people that I see, they come in and they're rubbing their hands, all right, because they have just come from another's room. They have just come from another patient's room. And this is to protect patients against harmful germs carried by the hands. Before any clean or aseptic procedures, nurses should be washing their hands, because we, again, are making sure that we understand that it is our own body that also carries germs. Nurses, you may not know this, but most of us are carrying bacteria on our skin. Most of us are carrying MRSA on our skin. But because we have such a strong immune system, the MRSA does not present as a problem to us. But yeah, most healthcare workers have MRSA in their nose, MRSA on their skin. So when we are about to do a sterile procedure, we need to make sure that we are washing our hands for our patients. After body fluid exposure risk, so whenever you have a situation where you're handling somebody's body fluid, their urine, their blood, their stool, you need to wash your hands. And I always say this, I know people say, well, you can use hand sanitizer, but if you've come in contact with a patient's stool of any kind, whether it has C. diff or not, wash your hands, please. Wash your hands. All right. And then after you take off your gloves, wash your hands. All right. After touching a patient as well, we are not supposed to use gloves to touch patients' skin unless they are, unless they have some sort of contact illness. Okay. But when you're taking a blood pressure or you're listening to a patient's lungs, ideally you're not supposed to have on gloves, because at the same time, when we are trying to protect ourselves from the patient, we also have to not make them feel, what's the word I'm looking for? When a patient comes in, we don't want to make them feel like they are marginalized or they're treated differently because of illness. It's such a fine balance to be a nurse. If you come in and you start putting on gloves to deal with a patient, that actually can harm them mentally. And that can help, isolate. I like that too. That can help prevent from you developing a therapeutic relationship with them. So yeah, all right. And somebody's NCLEX don't like when we waste products. That's right, Lily, too. And NCLEX cares, you got to care about the budget, okay? And you cannot just be buying gloves all the time. I like that too. So there's times where you are not expected to have gloves on. And so you need to wash your hands when you have touched a patient's skin. And then, this is so important. This is so important. And I think a lot of nurses miss this. When we are touching patient surroundings, when you come into a room and a patient's in bed and they're like, hey, can you hand me the call button? It fell on the floor. When you pick up that call button, understand that that probably has the most germs than anything, that call button, right? Because housekeeping may not have wiped it down between the second patient that was there. The beds of the patients, over the side tables, bedside tables, the door handles, all of those things have germs on them. And so we're doing hand hygiene to prevent ourselves from taking those germs with us. And so hand hygiene is washing your hands. It's also using the alcohol-based hand sanitizer, as long as it has at least 70% of alcohol in it. Good. Okay. All right. We are here as we're going through this. I love this class. I love what we're doing right now, but set your alarms, because tonight, I don't have the time on here. Somebody asked, what time is RNU? That's a great question. If you know what time RNU starts tonight, where we're going to go over pharmacology, we're going to fill out the workbook, put it in the comments. Tonight at 8 p.m. Eastern time. Yes, Remar Nurse University. And it is only happening on this Monday, right? This Monday for the week. We're only doing this one Monday, okay, this week. So I won't be doing RNU no other time this week, but Monday. And then the next Monday, I'm going to do it. And then the next Monday. All right, 8 p.m. Eastern time. You guys got it. You guys got it. All right. And so if you haven't signed up for it, it's still not too late. Go to remarnurse.com/RNU. So if you're in the Pacific time zone, that's going to be 5 for you. All right. So just convert the time zone, because I'm going to start on Eastern time zone. Okay. All right. Let's do some NCLEX questions. Okay. Let's do some NCLEX questions about the concept of infection control. I expect everybody to get 5 out of 5. That's just what I'm expecting. And I never say 5 out of 5, but this is a very practical subject. And I expect your knowledge to be able to support you, because I did not have critical thinking, or I didn't have to do any crazy case study. Like, this is just, do you know this or not? Okay. So are you ready for 5 out of 5? Everybody understand the goal? 5 out of 5. Let's go. Question number 1. Okay. Which action of a nurse is correct when setting up the sterile field during a dressing change? Number 1, holds an unopened sterile package 6 inches above the field to drop item into the sterile field. 2, uses alcohol to cleanse the irrigating solution bottle. 3, opens the sterile field unattended while obtaining the sterile gloves. 4, dons sterile gloves before opening sterile package. We go. First opportunity to get this question right. All right. RNU starts tonight. Right here is where we will be going over all the information. If you already have my NCLEX review, RNU is a separate experience, so you might want to show up for it. Even still, the workbook is different and it's free, so there's no excuses why you can't come. Okay. I see the answers on the screen. I'm happy today. You guys had it. Number one is the right answer. Congratulations. Holding the unopened sterile package with items 6 inches above the sterile surface helps prevent contamination because the outer portions of that packaging are non-sterile. So if opened correctly, the inside of the sterile wrapper would be the one that's open to the sterile field. Good job working that out. I'm moving on. Okay, let's do question number 2. I'm expecting perfection today. Question number 2. The nurse understands the correct infectious precautions for clients with hepatitis A when the nurse does which action? Okay, Hep A, which action? Number 1, wears a mask, gown, and gloves when taking the client's vital signs. 2, wears gown and gloves when changing the client's underpads. 3, wears cap and gloves during perinatal care. Or 4, wears gloves and gown when conversing with the client. What are we saying here? Got to know this. Got to have it memorized. Hepatitis A, hepatitis B, hepatitis C, hepatitis D. Got to know them. Correct answer. Number 2, the action is correct when she wears a gown and gloves when changing the client's underpads because contact precautions should be taken with a gown and gloves worn during this procedure because hepatitis A is a virus that is present in the feces for 2 weeks. 2 weeks when the symptoms, after symptoms appear, and it can live, this is the scary part, several months outside of the body. Several months outside of the body. So be very, very careful. Hepatitis A is a thing, especially, well, let me just be quiet. Just be careful, especially when you eating out on these streets, y'all. I know I love a good food truck like nobody's business, but I'm a nurse. And so hepatitis A is always lingering in my mind. Okay, let me go on. Perfection. Good job, Wes. Question number 3. The nurse understands that the infectious precautions for clients with a history of chronic hepatitis C is which of the following? Okay. Number 1, droplet. 2, airborne. 3, contact. Or 4, standard. Standard. Here we go. The nurse understands that the infection precautions for clients with a history of chronic hep C is which of the following? What are we saying, Remar nurses? Number 1, droplet. 2, airborne. 3, contact. 4, standard. This is, again, either you know it or you don't know it. Infection control is pure memorization. There's no critical thinking here. I see the right answer. I see the wrong answers too. That's okay, because you showed up to class. We're going to correct it. Correct answer, hepatitis C is always standard. Always standard, no matter what else is going on in the case study. All right. If it's just hepatitis C, it's standard because it's in the blood. Standard precautions. And we protect ourselves from anybody's blood or body fluid, whether they have hepatitis C or not. So, yeah. Question number 4. I may have lost some people's perfection there, but let's try again. Question number 4. The nurse is taking care of a client who is in reverse isolation. Which statement by the client is correct regarding infection precautions? The client says, my visitors should stay 3 feet away from me. That's number 1. My visitors should stay 3 feet away from me. Number 2, my boyfriend will bring flowers for me to help me feel better. 3, my relatives who would like to visit me, they're welcome anytime. Or 4, my visitors should wash their hands before entering my room. What are we going to say? And I would say here, reading this is very important so you don't get mixed up in what you're being asked. Correct answer number 4 is 4. My visitors should wash their hands before entering my room. Reverse isolation, neutropenic precautions. It's the same thing. Hand hygiene, utmost important. It's the best way to prevent the transmission of diseases. Okay. I see everybody pretty much have 4. People pretty much have 4 already, so you understood it. Okay, here's this one. Last question. I'm giving it to you today. It's RNU bonus time. Healthcare provider diagnosed the client with generalized infection. Which assessment finding should the nurse expect? Number 1, hyperthermia and widespread muscle aches. 2, swelling and pain at the site. 3, nausea and vomiting. 4, hypotension and bradycardia. Remar nurses, the comments are on fire. They're blazing up. I have so many, I can't even read them. This is a good thing. This is a good day. All right. So the correct answer here, controversy. Correct answer is going to be number 1, hyperthermia, which is a fever, and muscle aches. Because what are we talking about? We're talking about a generalized infection. So what do you feel when you are sick, when you have a virus or you have the flu? Because those things affect your whole body. So it's systemic, and that's what you have to think about. Muscle aches, fever, headache, malaise, anorexia, elevated white blood cell count, hypotension, tachycardia, mental confusion. I love it. Give yourselves a hand. I'm warming you up for tonight. So if you did excellent, if you're happy with your performance today, you probably know this topic very well or better than you thought. Okay, better than you thought, which is great because I said this was a big portion of NCLEX. Even for myself, I saw a lot of safety and infection control questions. And it is because, again, this topic is applied to all healthcare workers, all nurses, all settings, and all patients. And so you have to be prepared to do all of these things all the time. I love Monday motivations. Our Monday motivation idea is worry looks around, faith looks up. And this is for my people who struggle with worrying. And it might not be something that you do all the time, but you do find yourself, or is this you? You find yourself feeling really good some days, but then other days, if something happens that you weren't expecting, you find yourself going back to like, oh man, just having those thoughts, those thoughts that you can't really shake. And the thing about worrying, this is what we learned during the anxiety workshop, is worrying is a different process because when you worry, you actually are controlling that thought. Let me say it again. When you worry, it is because you are directing those thoughts. And so what do we need to remember? All right. And that was something really powerful that hit me. And it was just like, oh man, when I worry, I can't blame it on anybody else. It is not somebody saying, okay, like if I said yellow balloon, right? Yellow balloon. Everybody has in their mind a yellow balloon. That was a thought that I gave you. Like you just like, oh, okay, yellow balloon. It comes into your mind like that, and then it goes away, right? But when you worry, that is yourself telling you, yellow balloon, yellow balloon, yellow balloon. And it's like, nobody is talking about a yellow balloon. Nobody cares about it, but you yourself are bringing it up. So understand when we talk about worrying, it is something that comes from the inside. So this is my favorite scripture ever. It's Matthew 6:33 in particular, but I wanted to start with this. And it's a commandment. So don't worry saying, this is Jesus talking. So don't worry saying, what shall we eat, or what shall we drink, or what shall we wear? For the pagans run after all these things, and your heavenly Father knows that you need them. But here it is. But seek first his kingdom and his righteousness, and all these things will be given to you as well. Therefore, and this is again, it's telling you again, therefore, do not worry about tomorrow, for tomorrow will worry about itself. Each day has enough trouble of its own. I like in the King James Version, it says, sufficient are the worries of today, meaning everything that you have going on today, you have no room to think about tomorrow. You really don't, because you should be living in this present time and dealing with all of the things that you have going on right now. And for most of us, let me go back to this. For most of us, what we're eating, what we're drinking, what we're wearing, those things are assured to you as the air that you're breathing. Most of us are not dealing with food insecurity. We are not dealing with shelter insecurity. So when we are choosing to focus on these very, very, very small things, what happens is you don't have enough room for the big major things in your life. Like, am I pleasing God today? Am I living out my purpose? Have I been a blessing to somebody else? Because you worry what you about to DoorDash. You worry what's the next thing I'm about to DoorDash for lunch, right? And you have not considered the bigger picture. Most of us, if we're honest, we could skip a few meals. We really need to skip a few meals and go into some fasting during times of trying to get our goals. So thinking about the clothes that you're wearing, thinking about these little things, the Bible goes and talks about when you see the birds, when you see the flowers, they all have their needs provided for. So you being the son and daughter of the Most High, how well does the Lord know how to provide for you? Really, what are you worried about? What are you directing your mind to dwell on? What are you directing your mind to feel insecure about? Why are you not walking in faith? Because of what? It's because of our focus is on the material things, right? And so what we are reminded, what we are commanded to do, and this is before I met Mark, before I got married, before I, had Remar, before I had anything, I literally lived by this scripture. Seek ye first his kingdom and his righteousness, and all these other things will be added. And that has been so true in my life. When I got serious and put God first, everything else just started coming like this. And it came fast. And it was things that I had been wanting for so long. But my focus and my priority, the thing about it is, I wasn't in a position to receive the blessings. Sometimes God can't bless you because you're not in a position to receive it. You wouldn't even be ready for it. And so that's what we have to make sure, that we're doing our part. We're in alignment with his kingdom, and don't forget his righteousness, because it's not just about God's eternal glory. It's, are you going to fit? Are you going to match when you get up there? It's like, you don't want to go into a party and everybody got on purple and you are in there wearing green, because you don't fit, you don't match. And so taking on the righteousness of Christ, having his mind, is a big part of you being able to appreciate and experience and share his blessings. Most of us want money. Most of us want to be financially secure, right? That's not a bad thing. But when things come from God, you understand that you're blessed to be a blessing. And so when you get that large sum of nursing money, you are able to freely give and help and be God's hands and be God's feet. There's a certain character of righteousness that you have for you to even be a blessing for somebody. And so that is what we should be working on. Those are the thoughts that should consume us during this time. Everything else will be added because God knows what you want. He knows you want the license. He knows you want the marriage. He knows you want the car. And he's not above giving it to you. He's a good father. He wants you to be blessed. He knows you want the vacation. He knows you want your kids in private school and all these things, right? All these things will be added. But living right now in this moment and not waiting for something else to happen. No, seek his kingdom now. All right. Seek his kingdom now. So that's what I wanted to just impart on us for this Monday. God knows what you need before you even ask him. You don't have to worry about the things that you're worrying about. Okay. That's not part of your assignment. That's not part of your job. And so when you're out of your scope of practice, number one, you're going to end up harming yourself or somebody else. This is nursing too, right? You go to work and you think you're going to do a surgery on somebody, you're going to harm yourself and somebody else. And that's what it is with worrying. You don't have the capacity to worry about things because you don't hold the future in your hands, but you know who does. Okay. Focus on your present situation. Oh man, that's one thing that I don't like about worrying is that it steals time from us. When we're worried about something, we are not able to fully enjoy what's in front of us. And I see it happening to parents who are stressed out all the time. They are constantly worrying about their children. They're constantly worrying about bills and how they're going to make it, right? And that's a real worry. But what happens is you get into a cycle of doing that and you realize, man, your kids are graduating high school and where did the time go? You totally missed their childhood because you couldn't get out of the thing, right? And so I want us to be able to live every day the way God intends us to. It says, stay in the present. Pray and give it to God. Okay? Pray and give it to God. Be anxious for nothing. I like that. Be anxious for nothing. All right? Because it's all yours. You have everything you need right now to be successful. I hope I can see you guys. I hope I can see you guys tonight. Remar Nurse University starts. We have everything we need to be successful. Let's go into that mentality even tonight when we come together to study. Let's go into it. We have everything we need. If the Lord never blesses you with anything else, you already have all of your needs provided. That's the truth. You're in your right mind. You have all of your needs met. All right. You have a reasonable portion of health. And so I want to make sure that you are positioned to receive the blessing. Position to it. Now, many people won't tell you that. And let me tell you this. Many NCLEX reviews. I'll go on. I'll say pretty much nobody else. Okay. In education and nursing education in private businesses are telling you that Jesus is the way, the truth, and the life. But Remar, it's all up in here. So if this is your first time and you're like, whoa, this is a lot. This is who we are. This is us just being our authentic self. And I know it might not be for everybody. All right. And you might be thinking, I don't know, but there's a reason why you're here. Nobody just shows up here by accident and stays around. There is a reason that you are here. And so if you found that anything I said about the Lord resonated with you or tugged at your heart, I do want you to consider you have a creator who loves you and who cares about you and has a purpose for you. And nursing may just be a small part of a much bigger thing that you are going to do. Or nursing may be the vehicle that allows you to do the ministry that you are supposed to do. Okay. And that can take place inside and out the hospital. So all I'm saying is that you're not here by accident. All right. I'll see you tonight. Remar Nurse University starts tonight. I love you. I love you, love you, love you. I'm telling y'all bring my spirits up. Every Monday when we come together like this, it's uplifting to me. It is motivation to me. right? And it blesses my soul. So tonight we have even more. It's a special Monday. We got part 2 coming up tonight. I will be here. You'll be here. Set your alarms. We got Remar Nurse University tonight. And as always, you can, you will, and you must pass NCLEX.